If you're a woman, I need you to stop and I need you to watch this video. It is October Breast Cancer Awareness Month and we are going to save some tatas. 6 months ago, I had a double mastectomy at the young age of 43 and reconstruction, and I'm going to show you how to do a self-exam today. So save this video and come back to it every single month because 1 in 7 women will be diagnosed with breast cancer in their lifetime, and you want to have early detection. Hopefully this does not happen to you, but early detection is the key to survival. The first thing you want to do every single month is you want to look in the mirror completely without your top on, and you want to be able to look at every single different angle for different changes in your body from the breast tissue, the nipple area, and you want to raise your hands overhead and look at the different areas, see if there's any puckering, if there's any changes in colors, if there's any change to the nipple area. You want to see if there's any changes. Changes are not what you want. For this next part, I recommend you doing it lying down, but I'm going to sit down just to show you in the video. You're going to want to put one hand behind your head and then with 3 fingers, not 1 or 2, but with 3, with the pads of your finger with light to medium pressure, you're going to want to do circular motions starting in the armpit area because this is where you have lymph nodes. And oftentimes with breast cancer, there is lymph node involvement. So you might feel some swelling or some lumps. So you want to do, again, this circular pressure all throughout the lymph node area. And what you're looking for are lumps, little pea-sized feelings, any kind of changes, anything that hurts, anything that feels tender, any changes. And then after you do the lymph node area all the way around, you're gonna wanna start and just do circular motion, overlapping, making sure you don't miss anything, all the way through the sternum area and then overlapping all the way through. And so obviously not like this, but you're gonna wanna do this motion all the way through. I'm not gonna show you just in the interest of time, but all the way through. Now, they say that you can do it in the circular pattern or you can do it up and down. Here's what I recommend. Take the time to do both because you could save your life by just being extra thorough. Do this at least once a month. And the reason why I say at least once a month is because during your period or during the time of menstrual cycle changes, you might actually have more lumpy breasts. If you have denser tissue, it's harder to feel it because, again, you have denser tissue, so everything feels kind of lumpy. I actually, just to give you a little bit of background, I was breastfeeding at the time of having my lump. I told my doctors for 2 years that I had a lump that was not going away, and they said it was most likely a milk duct. So here's the last step. If you feel something and you're telling your doctors and they're not listening, you have to advocate for yourself. I could have been diagnosed a lot sooner. I wish I had advocated harder. Who knows, but I'm here and I'm alive. So again, advocate for yourself. Do this every single month. If you have any questions, please ask them below. Save some tatas, send this to your friends. I wish you a very healthy, long life.